and call the meeting to order. So with that, let me say welcome to everybody, and thank you for joining us for our Lions Club meeting today. And it's time to call to order the oldest Lions Club in the world. So again, it's fun to when Thursdays come around and we have a chance to be together. I see Chuck has already put up the words for the. Let's see. We probably need the Pledge of Allegiance first. There we go. There we go. And so we're going to move right into our pledge. And today, our numbers person, our finance person, Jim Roberson, is going to lead us in the pledge. So as you are able, would you please stand and let me ask Jim to go ahead and take it from here, please.
Okay, now I want y'all to know that I'm looking out the back of my office at a United States flag and a Texas flag flying on some poles across the valley. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Of course.
Oh, all right. Thank you so much, Jim. And we catch a little feedback there. Not everybody remembers to get muted. And so we hear a little echo, but thank you, Jim, for leading us with that. All right. So we are ready to move on with our agenda. And do we have, we like to introduce our guest at the beginning of the meeting. So Anne, I see your hand up. Would you introduce your guest, please?
Yes, I have several guests, including our speaker, who I will introduce later. But my friend Deanna Resnick is joining us. She's waving, as well as her mother, Elsa. So welcome to them.
Well, indeed, welcome. Thank you for joining us. Thank you, Anne. Do we have other guests? If you will raise your hand, I'll see if we can recognize you.
Okay, Rudy, I have
yes.
guests.
Yes. Okay. Thank you, Sid. Go ahead.
Okay. Our first guest is Gail. This is her first time here, and welcome, Gail. I'm so glad you're here. Raise your hand. Okay. Gail is here. Because she and I years ago started dancing together. We were tapping together. And now we Zoom every month rather than get together to dance. And our next two guests are Susie and Kit, who have been here before. And want to just say that the four of us, Chuck and I and Susie and Kit, are going out to the camp on
Wonderful.
10th. So we're excited about that. Welcome, Susie, Kit. Glad you're here.
And again, welcome and glad to see everybody. Anne, you have your hand up?
Yes, I do. I see Dr. Eric Crowell has joined us, and I believe he is with, hi there, and who else is with you?
This is Dr. Eileen Bowden as well.
Wonderful. We're glad to have you. You're from the UT Dell Medical School. Yes. Thank you. Well, we're delighted to have you both.
Yeah.
And I'm not sure, is Randy Shepard, Randy, are you with the medical school?
I am.
Wonderful. Well, we're glad to have you as well. Thank you for joining.
And welcome to all of our guests. All right. Well, thank you so much, Anne, and all that are joining us today as guests. Any other guests by chance that we don't want to miss anyone? All right. Well, again, welcome. And so we are moving on with our agenda. And we are going to take a moment for some business that needs to be taken care of according to our Constitution. And it is time to open the floor for further nominations for our board of directors. Let me just say in review that last week we had a list of nominees for the next board presented by our nominations committee chaired by Ann Ward. And there you see on the screen, thank you for putting this up, the nominees that are being presented by the nominations committee. And so today, I want to take just a moment to read from our Constitution so that it's very brief, but it's very clear. It says nominations may be made from the floor during the last meeting in March, and today is our last Thursday in March. No further nominations will be accepted after this meeting. A finalized list of all candidates for all offices will be sent by email to all club members the day after the last meeting in March. So the last meeting being today, and the day after today, of course, is tomorrow, Friday. And so that is how our Constitution guides us. And so for today, it calls that we open the floor, that I as president open the floor, which I am doing at this moment, and will be happy to receive any further nominations. And so let's see, I'm going to ask maybe Ann, if you will help me identify any hands that are raised so that we don't miss anyone. And so
has her hand raised.
I'm sorry?
Judy Saul has raised
Okay,
her hand.
Judy. Yeah, Judy, I am looking for you on the screen, but go ahead, please.
Unmute yourself, Judy. Look, where'd you go?
Okay, I got it. Thank you.
Yeah, there you are.
I'd like to continue serving our Lions Club as a director.
Okay, so you are nominating yourself to be considered for the new board as director. Is that correct, Judy?
Yes, please.
Okay, so Chuck, if well, let's see if we have. Let's just make a mental note here. I want to go back to the screen here in a moment after we receive all the nominations, if there are any others, and identify where Judy is asking to be considered. All right. Before we go back to the screen, are there any other nominations for the board of directors? Seeing none, Chuck, if you will, please, or Mark, yeah, Mark, if you'll put the list back up so that we are looking at the list, and Judy is asking to be considered where it says current directors there on the lower right side, and it has John Niefler, Sam Reese, and Kim Wright will serve the remaining 1 year of their terms. And then above that, director for 2 years, Chuck Mandelbaum, Rachel Reed, and Siva Venkadaru. And so the way I understand this, those that are in the John Niefler, Sam Reese, and Kim Wright have already been appointed last year to serve a 2-year service. And what we're looking at right now, they have 1 year remaining on their 2-year term. So really that is not a position that we want to modify in any way. So we will be looking at the director for 2-year terms. where Chuck, Rachel, and Siva are there, and that's where we will add Judy Saul's name, so that when the election is taken next Thursday, there will be 4 candidates for those 3 positions, and we'll be voting at that time. Any questions of this process?
Well, yeah.
Yes.
Comment. There are a lot of new people on this ballot, and I hope that when we vote that we do get the new people into the system early, because that's the lifeblood of the club.
Understand. Well, well said. Thank you, Chuck. All right. If let me again just say, are there any or ask for any other nominations before we close and we move on with the agenda? All right, then we've conducted our business as outlined by the Constitution. We have received 1 additional nomination, Judy Saul, for 2-year director position. And so with this, we are closing nominations, and no more nominations will be accepted. And our next step, according to the Constitution, will be tomorrow, when we send out by email to all members the list, including Judy's name, which was just added to everyone for consideration, and then the election will be next Thursday. So I believe we are done, and thank you so much. Thank you, Judy, for your wanting to continue to be on the board. So the next step then is tomorrow, when everyone will receive this information by email. Let's move on to the getting back to the agenda. We have some announcements, and here we go with announcements. This is hot off the press. All right. Well, maybe not so hot off the press. We are reminding everyone that we have a project, a service project scheduled for tomorrow, Friday, Meals on Wheels. We are happy to be participating with Meals on Wheels. It'll be at 8:15. We're asked to be there between or by 8:15, and it'll be over at 11. So it's still about a 2.5-hour venture, and I hope that we will have enough. We're looking for 8 to 10 volunteers. I believe we have about 4 or 5 so far. So if you can come out and join us at Meals on Wheels, you'll be welcome. Okay, here's another announcement, hot off the press. This is concerning the work day at the Texas Lions Camp on April the 10th. That's coming up in a couple of weeks or a little bit more. It'll be a Saturday. We're hoping to have 15 to 20 volunteers. The work that we will be doing is cleaning flower beds around the dining hall. So the tools that we will need are garden type of tools, rakes, hoes, the pruning tools, that type of thing. But also remember, for those that are coming out, to wear protective clothing, wear a hat, bring a hat, long sleeves are helpful, sunglasses, sunscreen, just those type of, and gloves, those type of protective items, as well as a mask. And so this year it's going to be different. You know, COVID is still very, very much a part of our, I guess, I hate to say the word normal, but it just seems to be getting into everything. So here's what COVID has done. It has closed the camp as far as overnight sleeping accommodations on Friday night. So so for those that are able to join us and would like to go the day early Friday, you will need to make your own overnight reservations and work those accommodations out. So again, we're talking about April the 10th, which is a Saturday, and going back to last week's information, Sid shared that she and others were staying at the YO Ranch. I have, and which is a great arrangement. The camp is expecting somewhere around 300 or 400 lions over from all over Texas, and I don't think the YO Ranch has that many rooms. But if you are interested and want to give them a call, please do so, and or other hotels in the Kerrville area. So those are the announcements. Maybe one more announcement here, and that is having to do with the district convention, the 2S3 convention. I hope you received in the email in the last couple of days the schedule, the agenda that will be followed at the convention. This is scheduled on May 1st. It's a Saturday. It'll be in Taylor, which is just a short drive over there to Taylor. It'll be 7:30 in the morning to about 3:30 in the afternoon. A one-day convention. Encourage everyone that has not been to a convention that's in the local area to attend. And I need to also say that this will be the first convention we've had in the past year, I think, that will actually be in person and not just virtual. So there'll be a small charge for lunch that's being provided that day, and so I hope that you'll consider going. We're eligible as a Lions Club because of our membership. We're eligible for 9 delegates to participate in the business meeting, and so I hope that we can send at least 9 representatives to have a good showing for our club. Well, a lot of announcements, and so that took care of our announcements. And let me see, we're moving on to birthdays. And March 30th, let's see, today is the 25th, so March 30th, like next Tuesday, will be Lion Bill Taminga. Bill Taminga's birthday is coming up next Tuesday, March 30th. So happy birthday to Bill. And now we've reached the part of our meeting where it's gonna be fun time. We're gonna, ever so often we have a chance to have member profile. And today's member profile is Sid Papinski. So we've been looking forward to this, Sid. So thank you for your preparation today. And so let me turn it over to you. So go ahead, please.
Chuck, can I share the screen? You're muted, Chuck. You're muted.
Just hit share screen, Sid, you're okay.
Okay, I'm fine.
Now hit your presentation. There you go. Now hit slide show.
Okay. Here we go. Hi, everybody. I want to introduce you to me, and also wife of Chuck Mandelbaum. I was born in Newburgh, New York. Excuse me. My father owned an Army and Navy store, and we were visiting him that day. My brother, Art, and Steve, and me. Fortunately, we're all together, and we Zoom every week. Here they are now. And when I graduated from Newburgh Free Academy, I went to the University of New York in Buffalo, and I met a very handsome, talented artist, Arnie Popinski. After that, I graduated I didn't graduate, Arnie graduated from the university, and he brought us to the University of Wisconsin, where I graduated and had an education degree. And he started his career at Beloit College, and I taught 4th grade that year. Tommy, you'd be interested in this. We found a very young, just out of school architect who needed a client, and he designed this house for us. And
Nice.
he actually came in budget for someone who was a college professor. Here we go. 2 years ago, I found out that our house that this architect designed had a name. It was called Mid-Century Modern, and it overlooked the creek.
Nice.
36 feet of window space. I couldn't find better photos. I have them. We also had 2 children, Diana and Mitch. And after a while, I went back to the University of Wisconsin and got a master's degree in library science. And lo and behold, Rockford Public Library hired me, and I worked there for 2 years. Meanwhile, I was president of League of Women Voters. And since I was very interested in the water quality of our creek, of Turtle Creek, the League studied water at the time. And it was 1995? No, 1965, I think. We walked the creek, we took our boats in, looked at the quality, and the newspaper thought we were pretty good. After 19 years in Beloit, I applied for a job at the Texas State Library in Austin as a continuing education consultant, which was pretty new at the time in 1976. While I worked at the State Library, my husband, Arnie, opened a pottery shop.
Oh,
And that was on West Lynn. Also, we went over to Central Market, as well as we had a shop at the Arboretum Market. In this year, whatever year it was, we became Best of Austin. And Arnie and I have always been involved in activities in town. And this is a group that we're still involved in. This is where I met Kit and Susie. One day, I was ushering at our Jewish temple, and I met this very handsome man, and he liked to usher, he liked to travel, he liked to play bridge, and he enjoyed parties. And so in 2016, we got married. I was a June bride, and it was fun. I also, during this time, was tap dancing. Here's our group. We don't tap dance anymore, but we meet on Zoom or we go out for lunch together. And then, because Chuck was so interested in the Lions Club and had been for many, many years, he brought me to a meeting of the Downtown Lions Club. And the reason why I joined it was that I found the group to be friendly, and I was impressed with the volunteer activities, and the speakers are great, and the programs are always interesting. And I became involved in the Vision program, really enjoyed it. And I just thought the organization was right for me. But most important is that Chuck is a member. And that way we can share that experience together. So I want to wish everybody happy Easter and happy Passover. That's my profile.
Well, wonderful. Thank you so much. We learn so much each time
Sit on
that
chair. There you go.
we have our member profile. So today, Sid, thank you so much. We didn't know you had such an artistic background, and so yes, great. But it's we want to allow as much time as we have for our speaker. So let me ask Ann Ward if we can just move on into our program, and would you introduce our speaker, please?
Yes, Rudy, thank you so much. We are delighted to have one of our very own speaking to us today, Jane Edmond. Dr. Edmond is the inaugural chair and professor of the Department of Ophthalmology at Dell Medical School. And as you all know, she is the director of the Mitchell and Shannon Wong Eye Institute. This program is going to be very interesting. So Jane, please share with us.
Terrific. Thank you so much, Anne, for inviting me. And thanks to the Austin Lions for being allowing me to be a member and allowing me to give this presentation. So we'll kick it off. Hopefully, that's no good. Hold on one second.
Push play. No, not.
Do you see my, do you see the screen?
Yes.
Okay, let me navigate over there. Oh my. Hold on one second. I'm having technical difficulties. My assistant Nicole is here somewhere. I can't find my mouse. Folks, I need, there it is. Excellent. Okay. Nope, don't want that. Hold on one second. Your
PowerPoint has disappeared.
Okay.
I think you just need to share your screen and then click on the PowerPoint. You've got the share screen, so just click on your PowerPoint.
Yes, and I'm having, this is going to help immensely. Okay. And share, so I've lost the share screen button, sadly to say.
Well, you're already sharing your screen. We see your screen.
Oh, you see Ocular Health Disparities?
No, we see your screensaver. You just need to, you've got a bunch of little things, icons. Oh, there it was at the bottom. Whatever you just did there.
Drag it up.
Drag that up. Or maximize it.
You know, and I've lost all of, I've lost the Zoom bar. Gosh, guys, I'm so sorry.
Well, that's okay.
Grab that orange top of that presentation, drag it up. Grab that orange bar and drag it up.
You know, I don't even have the orange bar anymore.
You don't see Lions Talk?
Yes,
on the bottom. Put your pointer on that orange bar. Lions,
oh, yes, there it is.
drag it up.
There, keep
Drag
going.
it more. Whoa.
Oh,
What you do it?
Do you see it there?
No, you had it there, but then you took it away.
Oh, golly.
Go to the bottom of the screen and then just drag your mouse
Double
up.
click Lions Talk up in the middle there, next to we have Lions Talk.
Hold on one second.
1, 2, 3, 4th row down.
Oh, Nicole, I need help. I have two screens, and that's the trouble, is I'm trying to drag.
Oh, okay, go up here to the, see the
I think I have it.
Lions Talk 2021, double click it.
I think it's already open. It's just on your other monitor. We need to get it on this monitor. There we go.
There it is.
Yay.
Well, hold on. Don't go away, Nicole. So we want to play from this slide.
Right.
Right.
Now you see too much, right?
Yeah.
Just leave it, we can handle it.
How's
There we
that?
go. That's it.
Perfect. Perfect.
Thanks to God. Okay, I'm so sorry about that. Let me minimize everybody. Okay. Thank you, everyone, I'm sorry for the delay. I'd like to present ocular health disparities affecting women. Why do certain ophthalmic conditions affect women more than men? Two reasons. First, I'll discuss biologic vulnerability / strength, and then second, societally constructed inequity. So ocular health, women are not equal to men. Women, well, for one thing, women account for 2/3 of all blindness and visual impairment in the US and, well, mainly worldwide. Also, there's a disproportionate amount in women compared to men in the US, although the gap is closer. So what is that? What's the reasons for that? Women's biologic strength or vulnerability? Well, it's the presence of estrogen, which you see in the first circle, and also the lack of estrogen that mainly informs vulnerability, and that's the last half of our life in the last circle. And keep in mind throughout this talk that women worldwide, for time immemorial, women have outlived men. In developed countries, the gap is smaller. In underdeveloped countries, the gap is a bit wider. But women in the US outlive men by 6 to 8 years. Average lifespan for a US male is 76, and for a US female is 81. So why do women live longer than men? Well, estrogen plays a role in that. Estrogen plays a role in DNA repair, and as I'll get into later, women have stronger immune systems, which is a strength and a liability. Also, conditions which are more common some conditions are more common in men, conditions that lead to a shorter lifespan. One is atherosclerotic disease. It's 2 times higher in men, and that may be in part due to the lack of estrogen, but also unhealthy behaviors. Other conditions which shorten the life of men, men are more likely to engage in unhealthy behaviors, neglect of their health, drinking, smoking, overweight, hazardous jobs, accidents, and suicides are much more common in men. So what about biologic strength? Well, the presence of estrogen is a strength in terms of anti-inflammation. Estrogen's anti-inflammatory, which leads to lower rates of infection in women until they are older, in menopause and beyond. So women exhibit a more robust biologic immune response to infection compared to men. They develop higher antibody responses and greater vaccine efficacy than men. Female sex hormones play a role in the regulation of genes involved in the health of the immune cells, and this may be the reason. Through every pandemic, women mortality rates for every pandemic, and I'll show you the slide about COVID, influenza, Spanish flu, and COVID, women die at a lower rate than men. So here's a slide that's sort of a pictorial representation of women's strengths in terms of responding to infection. So here's a slide from July of 2020 that the diagrams outlines sex-based mortality from COVID-19 worldwide. And you can see that men mortality rates were higher for men in every country, less in Sweden, less in developed countries, but still there's a bias toward men, increased mortality in men from COVID-19, while at least in the US, infection rates in women were slightly higher than men, but men succumb to COVID more frequently. So estrogen is also a biologic vulnerability. So because estrogen plays a role in making a more robust response to infection, it can go overboard and become inflammatory, which means autoimmune diseases. What is that? Autoimmune diseases are antibodies which attack the body's healthy organs. Autoimmune diseases in general affect 20% of the population, but at a 2 times higher rate in women. 80% of autoimmune conditions, 80% of these conditions occur in women. So here are some conditions that occur in the ophthalmic space. Sjogren's syndrome, which is you see a picture, photograph here, dry eye, dry mouth, dry nose, all your secretions are dry, arthritis, skin conditions, 9 times higher in women. Graves' disease or thyroid eye disease, which you see below, which causes bulging eyes, double vision, ocular movement abnormalities, wide open lids, 7 to 8 times higher. Multiple sclerosis, 4 times higher. Rheumatoid arthritis, 3 times higher. These are autoimmune conditions. And autoimmune conditions particularly kick in during times of hormonal change, puberty, pregnancy, and menopause. So another biologic strength of the presence of estrogen, it lowers our intraocular pressure, which is good. High pressure causes glaucoma, and we will get into that in a minute. So what about biologic vulnerability? Well, the lack of estrogen, which would mean menopause and beyond, well, that's a vulnerability. It elevates our intraocular pressure, which predisposes to, which causes glaucoma, and also dry eye disease is linked to aging and loss of estrogen. These are topics I'll get into in just a second. Also age, as we know, women outlive men. So if you live longer, you're going to get age-related diseases. And in the eye space, it is age-related macular degeneration. And I'll discuss all 3. So glaucoma is the 2nd leading cause of blindness in the world. Typically, it has increased intraocular pressure. That pressure slowly and painlessly permanently damages the optic nerve. So what does the optic nerve do? The optic nerve gives us our central vision and our peripheral vision. This preferentially affects peripheral vision so that you could be as if you're looking out of a cardboard tube, and then ultimately loss of central vision. The most common form, there are many forms, but the most common is primary open angle glaucoma, POAG. Women's sex hormones are protective against POAG, or primary open angle glaucoma. So here's a primary open angle glaucoma by age. Premenopausal women, as I indicated, they got estrogen around, they have significantly lower incidence of this type of glaucoma. But after menopause, the incidence of glaucoma increases, and by the age of 80 and over, women equal men. But overall, in the US, 11% more women than men suffer from this type of glaucoma. Why? Again, because women live longer. So what is dry eye disease? Dry eye disease affects 7 to 33% of the general population and increases with age. It is 2 times more common in women, and it begins earlier in life than it does in men. So to understand dry eye disease, the tear film has 3 components, and an abnormality in any one of those 3 layers leads to symptoms and signs of dry eye disease. So what are the layers of the tear film? The top layer is an oil layer, a lipid. It is created by these meibomian glands, which you see in the middle photo with the dark arrows. Those are little tiny holes that emit a healthy oil that stabilizes the tear film. The watery or aqueous layer is the thickest. It is made by the lacrimal gland, the major tear gland you see there, and smaller glands that line the inside of our eyelids. Finally, there's this mucin layer. It's very thin, and it is also created by some cells within the slimy skin that covers our eye called the conjunctiva. So dry eye disease are 2 main categories. There's aqueous tear deficiency, so a deficiency of the water, and then meibomian gland dysfunction, which is blepharitis in more simplistic terms. Those glands are producing abnormal oil, which disrupt the lipid layer, which disrupt the tear film. So what are the symptoms of both of those types of dry eye disease? Burning, stinging, itching, even tearing, reflex tearing because the eye is irritated. Seems strange that dry eye would have tearing, but yes, it may. Scratchy discharge, frequent blinking, blurry, fluctuating vision, light sensitivity. Causes of dry eye disease, rarely it's Sjogren's syndrome, an autoimmune disease, could be linked to multiple, it could be multifactorial, environmental allergies, medications which are oral or drops. It could be the preservative in the drops, refractive surgery such as LASIK, staring at computer screens all day like most of us are doing now, and definitely menopause. Postmenopausal women have a higher incidence of dry eye disease than men, nearly double compared to men over the age of 50. Dry eye disease is tough to diagnose because there's not one gold standard test, and secondarily, it is underdiagnosed. Treatment approaches vary depending on what type of dry eye disease you have. It's not just artificial tears. Dry eye disease can become a chronic pain syndrome. It should never be minimized or discounted, the discomfort from dry eye. And according to one quality of life study, dry eye disease was the equivalent of unstable angina or cardiac chest pain. Moving on to age-related macular degeneration. It is the leading cause of permanent central vision loss in people over 65 in the US, and we are living longer. In the age group of 65 to 74 years of age, 10% of people have or will develop in that span dry or wet AMD. There's two types I'll discuss. But over the age of 75, 25% have or will develop dry or wet age-related macular degeneration. And overall, 2/3 of people with AMD are women. So what are the risk factors for AMD? Smoking, overweight, hypertension, cardiovascular disease, family history of AMD. Caucasians specifically are targeted for this condition. It is very weighted to being white, also Asians. Also sunlight exposure, and obviously advancing age is a risk factor. This is dry AMD. Dry AMD is accelerated aging changes of the central retina. In the top photo, you see an optic nerve, and all those spots in the middle, that's the center of our retina called the macula. That's where our 20/20 vision comes from. And the rest of the retina outside that area is peripheral, takes care of peripheral vision. So you see here all these spots, they're called drusen. They are not normal. These are aging changes. The bottom is more advanced dry AMD. It is called geographic atrophy, where you get pigment dropout in a large patch where our central vision comes from, in the center of the retina called the fovea and macula. This big patch of depigmentation leads to more severe levels of vision loss. What are the treatments? Sadly, right now, we don't have much beyond healthy habits. Don't smoke, don't drink, exercise, wear sunglasses, and dietary supplements. They're called AREDs, a combination of antioxidants, carotenoids, and omega-3 fatty acids. And these preparations are available over the counter at the drugstore. Unfortunately, 10 to 20% of dry AMD progresses to wet AMD, which is a more severe variety, leads to more severe vision loss. And the term wet comes from the new blood vessel growth that occurs under the retina, which leaks fluid or blood under the retina, and that hence the term wet. Leads to more severe vision loss. And if you know friends or yourself that you go in every few months or weeks for injections of medications in the eye, these individuals have wet AMD. And right now, there's new discoveries being made that there could be a prolonged reservoir placed in the eye that would emit the drugs that are necessary to prevent the blood vessels from leaking and growing, so that patients don't have to go in every few weeks, but that's still on the horizon. So moving on to the second reason that certain eye diseases affect women more than men are societally constructed inequity. And this mainly refers to the global increase of blindness and vision impairment in women. Remember, 2/3 of blind and visually impaired women in our world are women. People are women. So it has to do with the determinants of health. There are many domains that inform and influence our health, your health outcome. And here is a pie chart that indicates those determinants of health for the US. It has much more to do than access to quality healthcare services, much more to, only 10% has to do with your doctor and the care you're receiving in the US. It has much more to do, and globally, here and globally, has to do with social and economic factors and healthy behaviors, 40% and 30%. So what are social and economic factors that influence health? Level of education, income, whether you're employed or unemployed, your occupation, and the social support you receive. Healthy behaviors, your diet, exercise, smoking, substance abuse, obesity, and diabetes control. So worldwide, women score lower in those main two domains that are in the domain of social and economic and clinical care. In the social and economic domain, worldwide women receive less education, they're less likely to be employed, that informs their income, and there's less likely to be social support. Men and boys take precedence over women in many underdeveloped countries' households. And then that also access to clinical care. If support and resources are being funneled to men and boys, then the women receive less when there is restricted resources. So again, worldwide, vision disorders affect women more than men. Women comprise 2/3 of all blind people worldwide. And so what are the two leading causes of global vision impairment, which happen to be treatable? Number one is cataract blindness. And worldwide, again, 2/3 are women. Blind from cataracts, a procedure that in our country takes 12 minutes to receive a lens implant. In developed countries, vision impairment from cataracts is equal in males and females. So this is a underdeveloped country issue. And number two, what do you think in your mind, what's the second cause of vision impairment globally? Needing glasses. The simple need of glasses is the second leading cause of vision impairment globally. So I want to thank everyone, and I'm sorry for my technologic hiccups. And happy to take any questions if there's time. I've lost track of it. But we've got a few minutes.
Yes, well, thank you very much for that wonderful presentation. I think you had all our attention because we're all in that aging group. So, but Anne, let me ask Anne, would you help identify those that have questions, please? If you will raise your hand if you do have a question. Yeah, Chuck, can you show the all those that are participating today, that's those smaller screens?
She needs to get the screen.
I believe Steve Riley has a question.
Forgive me, I had a couple of things that I had to attend to. Is it possible to share this slide deck?
Absolutely, happy to do that.
Yeah, please, if you would. Yeah, I had a cataract surgery at age 53 about 4 months ago, which you know, it's inherently so easily treatable, but it's astounding. I didn't realize I was walking around with one eye for so long. You don't know it until you finally get it done. So,
right.
Thank you. Great
Okay.
presentation.
You're welcome.
Deanna has a question.
Yeah, I'm really curious. What's your opinion about vitamins for the eye? My mom was prescribed, she takes these vitamins twice a day.
Yes. So does your, Diana, does your mom have macular degeneration?
Yes.
It has been well-studied clinical trials, multi-center clinical trials, prospective studies that those preparations do help stave off progression. So keep on keeping on.
And what about those that don't have it, but have genetically a disposition? Would you start taking them?
It doesn't hurt, but we don't think it hurts, but we do not know. I've asked this question because it runs in my husband's family. His retinas are fine, but we don't know.
Thank you.
Mhm.
I think Glenda has a question.
Yes, you talked about the dry eyes. Is there a particular eye drop that's better than others, or is it a generic? Okay, is an HEB one just as good as something else?
So Glenda, I'm a pediatric ophthalmologist and a pediatric neuro ophthalmologist, so I don't have a lot of my adult colleagues. They have their favorite drop. However, we do have some kids with dry eye, and this is what I say: buy the cheap one. If you're going to be on a long time, it'd be great to be on the inexpensive one. Also look for preservative free, because long-term use, you can develop toxicity or a reaction / allergy to the preservative. So look for preservative free, and then just start experimenting. And if those experimentations, you're still symptomatic, ask your doctor their favorite.
Okay, thank you. And one more question. When you said employment had a lot to do with it, is that because of income or because what women are doing is more dangerous for their eyes? I didn't understand the difference, the correlation between employment and eye disease.
I think in my mind, the employment, if the unemployed in sub-Saharan Africa or these underdeveloped countries, these have less stature in the family. So the elderly, blind people, women who are not working and relegated to keeping the home fires burning have less stature in the family than those that are employed and bringing in the money. Not that women are in risky jobs.
Okay. All right. Okay.
I don't have.
I think Tommy has a question.
I do. Jane, you're very familiar with our vision screening program that we are using and had for several years with AISD and several other school districts for their pre-K3 that we were using the Welch Allen spot camera. As you might guess, all of that came to a screeching halt and we're losing time. We have children that are probably going to be unattended, and I'll use that phrase, for probably another 3 years when they get back into the system to meet the state mandate for testing. What do you think is, may I pitch to any group making a decision, the process that might allow us to have some sort of testing within the 3 foot now range limitations? Could you help me with that?
So Tommy, I know that the founder of Half Helen, and I'm a bit blanking on her name.
Elliot.
Say again?
Her name is something Elliot. I forget her last name is Elliot.
Chelsea Elliott.
Chelsea, yes, that's right. So Chelsea Elliott reached out to me about a year ago when, well, you know, when COVID was raging, and I supported her pitch to the legislature and somebody in a state organization that makes these determinations. I think the individual's last name is Brown.
Correct. That's Mr. Brown. He sets the standards.
Exactly. So I do not have, he's not on my speed dial, so I can't help you there. Happy to help defend vision screening as a means of determining if children need glasses in this time when we are socially distanced and kids are not at school and so forth. So I don't have any.
Mr. Brown does the certifications for the testers, and he has been less than helpful. I guess what I'm looking for is to get some information from someone like yourself that has experience, especially with children, that I could speak to. And I may drop your name in inappropriate places, but this would be one literally. And if you have any questions, please call you.
And yes, and I'm past president of our national organization of pediatric ophthalmologists, and we may have created a position paper for this year of COVID to sanction alternative means of vision screening, which would be.
Send that to me. Would you please send that to me? I'm really looking. We're literally wasting time sitting here with kids that are not being tested at all, and in their processing, at least at AISD, it will be, since they've missed this window of opportunity, they're probably going to be 3 years again suffering under some disability without anybody paying attention to it. This is, as you might guess, also not the highest priority with any of the school districts with all the other COVID issues that come up. But in my mind, it's one that may have a longer effect than other issues that they're dealing with. So please send that to me if you would.
If we have that, I will, Tommy, for sure. I'll send it to Ann if I don't have your email address.
That's fine.
Pediatricians also, according to the American Association of Pediatrics, there's a screening guideline when it is indicated to give vaccines, when it's indicated to test hearing and vision. So there's certain age points, and pediatricians, due to a code that was developed about 10 years ago, they get paid for vision screening, which like tripled the frequency of vision screening. So it's terrible that y'all are unable to do your good work in vision screening, but hopefully pediatricians will pick up some of them.
Thank you so much. Great presentation today, by the way.
Oh, great.
Very well done.
Thank you.
Yeah. And Dr. Jane, you mentioned that there are some further research on the horizon that might address age-related macular degeneration. Could you comment a little bit more on that?
Right. So it's mainly in the, in the wet AMD space. So what is obviously inconvenient for patients is to go back to a retina doctor's office every 6 to 8 weeks for an injection. Puts the eye at risk for infection, clogs up the retina doctor's office to not be able to take care of other things, highly inconvenient for patients. And every time a needle goes in, as I indicate, your risk for infection is there and bleeding. So what I read about what's on the horizon is a insert inside that's placed inside the eye that would be filled with drug that leaches out over a long, slow, sustained release, so that you have to go back every 6 months and have the reservoir filled, but not every 6 to 8 weeks. There are also discoveries on the horizon or interest in longer acting drugs so that they last longer than 6 to 8 weeks, so that maybe you only have to go back every 6 months.
Very good. Thank you. And any other questions? Because
Norman.
Yes, Rudy.
Yes, Laura. Yeah, one last question from Laura.
Yes, I would like to know more about central serous.
What?
I would like to know if it's generic and what's the reason that we get it. I just had my injection today.
For central serous?
For central serous.
So I'm afraid all I know is from when I took my boards 30 years ago. So I'm not an expert. I know it's a condition typically of younger people and type A personalities that are stressed out. I think that was a question on my boards, but I'm sorry, that's all I know.
Okay, thank you.
You're welcome.
I think we're going to need to call time unless someone else has a pressing question. So let me,
Well, it's not a question, but in reference to your comment about how women in third world countries do not have as much access to eye care, we have a neighbor from Serbia who came here to visit her son for 2 months, and then the pandemic hit and she couldn't go back. So she has stayed, and then she developed cataracts. So she's had her cataract surgery here because she said it's not that available in her country.
Right, right.
I wonder if there's anything that can be, or if they will ever come up to standards.
A lot there, because cataract surgery is a short procedure, fairly safe, and you don't need long-term follow-up. There are a lot of medical missions and a plane called the Flying Orbit. It's a medical eye hospital. That's
good.
An airplane. And they go to these areas and teach local ophthalmologists how to do these procedures so that their educational efforts are sustained. Also the medical missions, you have a team of slit cataract surgeons. They can do 200 cataracts in a week.
Yeah.
Wow, that's excellent. That's good to hear.
But it should be done on, on site and by local ophthalmologists and providers. That's the long-term solution, right?
well, thank you again, Dr. Jane Edmond. So thank you so much. And we do appreciate quite an informative presentation today, and what more appropriate than to the Lions Club.
Yes.
So,
well, thank you for attending and your great comments, and proud to be a Lion.
wonderful, wonderful. We're going to return to our agenda, please. And I don't know if Drew Schreberl is with us today, but does someone have?
I have a question.
Oh, I'm sorry, Siva. Yes.
Yeah. I'm sorry if I'm late. Yeah. Hi, doctor. I'm 40. I re-diagnosed with keratoconus.
Siva, I'm sorry, you're breaking.
I have.
He's developing cataract.
Is it?
Yeah, Siva, I'm sorry.
Is my voice okay now?
Yeah, you're breaking up. Can you get closer to the mic? Yes, go ahead.
Is it okay now?
Yeah, go ahead.
Hello?
Get your question.
Hello.
Yes, hello. Yes, we can hear you.
Yeah. Yeah.
Maybe he needs to call her personally.
Yeah, Siva, can you hold on just a minute for your question? Yeah, I want to go ahead. And, yeah, can you hold on for your question? And Jane, are you still there? Did Jane leave us?
I think Jane's off.
All right. Okay. Okay. Well,
Rudy, this is Ann. I will get in touch with Siva, and maybe he can just send Jane an email.
Exactly.
Thank you.
Exactly.
Thank you. Yeah, we wanted to, we don't want to cut him off, but it was just a little hard to understand. And I was needing to get back to the agenda, and next week's program, I don't see Drew, who will be our presenter, on the screen. And Mac, I'm gonna need to fall back on you if you will help, please, about next week's program.
Yeah, next week is gonna be pretty unique. We have Drew Chevrolet is bringing us 2 speakers on the May bond election. Jesus Garza and Andrew Allison will be speaking to us on the 2 viewpoints of the strong mayor bond referendum, or referendum on that. And this is you don't have to be a political wonk to appreciate the importance of this. Oh yeah, thank you, Mark. Yeah, these are 2 high-profile people in the news and in local politics, and so And this is this issue has high import for Austin. So I hope everybody can attend.
Well,
next
thank
week.
you. Yeah, thank you, Mac, for that. The introduction or a preview for next week's program looks very interesting and very timely. All right, I believe we have concluded all that is on our agenda today. Thank you to all of you for attending. Thank you for Dr. Jane helping us, and to all that participated, to Sid for her wonderful member profile, and for Jim Roberson for leading us in our pledge. Roberto, do I see your hand up?
Yes. Yes, Mac, I need to ask Mac a question. I sent him a message that because I have the speaker for April the 22nd. Mac, did you get my message?
Oh, let's see. Was that a text or an email?
It was a text. Anyway, that's the only thing. We'll take care of it later, but.
All right. Okay. Thank you. Siva, I see you're back on. We'll get in touch with you in just a moment and see if you have a question for Dr. Jane. She's already off, so we'll get that worked out with you. So let me again say thank you to everyone for joining us today. Y'all enjoy your day. Tomorrow, look for something for an email with all the candidates, nominees for next year's board of directors, and next Thursday will be our election. Hope that those of you that can join us for Meals on Wheels tomorrow morning. I'm running out of breath. We've run out of time, so y'all enjoy. This meeting is adjourned.
Mac, send me a message. Robert Martinez, Mac.